kind of patients are you currently seeing in your dental office?
So I'm really limited right now. The last date that we had a full scheduled day was March 17th, or 16th or 17th, that last Friday of that week. So we've canceled all hygiene. There are no teeth cleanings. There's no veneering. There's nothing cosmetic. It's purely emergency right now. And any crowns that need to be seated that have been in temporaries for a while, we're seating a few of the crowns, but mostly emergencies.
What kind of precautions do you have to take in order to see a patient? Because this is so highly contagious from any of the mucous membranes, which is what your face is right up next to.
Yes, it's been tough because, like all of us, I've been through highs and lows with all of this, scared that, we are at such high risk that we wanted to make sure that we were protected. And so, as you know, information is coming out daily. So we've been changing our protocol as we find out what to do. But so far, what we're doing is we're emailing a questionnaire over that is asking the patient, have you traveled outside the United States? Have you been on a cruise? Have you had a fever? Do you have a cough? They bring that in, they print it out, they bring it in. My office manager, we have a thermal temperature scan. We scan their forehead, record their temperature. We send them right to the restroom. So there's no patient sitting in our reception area. And they wait for a text to be called in because we only want one patient at a time. They go straight to the bathroom and they rinse with something called peroxyl. And what that does is it's supposed to lower the viral count. And we put them into the operatory and we do what we need to do. As far as how the doctor and the assistant are dressed, so it's tough. It's tough to work like we're working right now. The N95 masks, I only have 2. So I'm running them through my sterilizer. I have a certain sterilizer that fortunately can sterilize the mask. So I'm alternating those. Over the N95, I've got my glasses, and then I've got a shield that has another mask. Then I'm wearing a disposable gown and obviously gloves. And then my assistant is doing the same. Because I don't have so many N95s, I was lucky enough to get some level 3 masks, which are supposed to be pretty good too. So I'm wearing the level 3 some days because the 95 mask hurts. It hurt, and it's hard with my loops to see past the other mask. And then my front desk, they are wearing, there's this controversy. Do you wear a mask? Do you not? But right now I have them wearing a level 1 just to protect themselves.
Are you, and you say you only have 2 N95 masks, are you having trouble keeping you and your staff stocked with the right protective gear?
Besides that mask, no. I was lucky enough to pre-order early on. And because we're only open 2 days a week, what I've been doing is the staff has a few disposable gowns and they also have a few washables. We're lucky enough that I have a washer and dryer in the office, so we're washing some of our gowns too. And then another thing that I'm doing, because I'm really limiting my patients, they say that aerosol, anytime you run that handpiece, there's a 3-hour span when that stays in the air. So what I'm doing, and I have 8 operatories in my office, so I'm alternating the operatories because I'm really only seeing, when I go in, maybe 4 or 5 patients. And then after the patient leaves, that room is completely sterilized, and that it sits until the next couple days so that we can ensure, to the best of our ability, that it is clean for our staff and for our patients.
What constitutes an emergency or something that you would need to work on someone quickly?
crowns that maybe came off and their teeth are sensitive, or a true broken tooth, that's really my emergency. And then, I have some colleagues in town that are they're endodontists, they're root canal specialists, and so I don't treat a root canal typically, so I'll refer them. But we're trying to filter.
How important is it that you do keep them out of the hospital emergency rooms? Because if somebody is in extreme pain, they might, if it's oral, they might still head to a hospital.
I think that there's been so much communication about how important it is not to go to the hospital, that I'm hoping people know that they can call their local dentist or endodontist and get at least on an antibiotic to keep things calm. And um, I think the worst thing that we could do right now is really to crowd those emergency rooms and take the doctor's time that need to be spent trying to fight this virus.
In the absence of our routine cleanings and things that we've had to cancel, what kinds of things can we be doing at home to really take care of ourselves and to make sure we don't run into some of those other issues?
I think that flossing our teeth and maybe water picking, flossing, using rinses, any antimicrobial rinses right now, and just doing your normal hygiene, brushing a couple times a day. I think that is really important. I think a lot of people are going to miss their cleaning this year. I think we're going to be so off track, and so it may be another year before you get in. But I think if I had to choose one thing, I would say flossing and brushing for sure.